Welcome once again. Moving on to the ventilation device, supraglottic airway. As we all know, according to NAP4 study, almost 56% of all the general anesthetic administered every year in UK is done with the help of supraglottic airway, and 65 to 100% of success rate can be achieved by supraglottic airway insertion for intubation and especially in difficult airways. This shows how much supraglottic airway device are going to be helpful, especially in case of difficult airway scenarios. So, we all know first generation, second generation supraglottic airway device. The guidelines always emphasize on utilization of second generation supraglottic airway device. So, even though there is no clear-cut definition for third generation supraglottic airway device, it usually refers to a device with self-energizing seal cuff like Mask or a vision guided supraglottic airway device. So, the guidelines says the choice of supraglottic airway device should be determined by three factors. One is the clinical situation of the patient, the device availability in that situation, and the most important thing is operator experience. The operator experience is going to play a major role. So, never try to explore with the newer airway gadgets, especially in case of difficult airway scenarios. So, again what they say is a maximum of 3 attempts can be done with the help of supraglottic airway device in difficult airway scenario, and the second 2 with the preferred second generation device, and the another attempt with an alternative device try to achieve a airway management. So, an attempt includes changing out size also. Suppose when we are trying to secure the airway of a patient with 3 size, when you go for 4 size in the success attempt, that should also be considered as a one more attempt. So, as we all know, they are emphasizing more on two things. One is the number of attempts. The second thing is passage of time. As we all know, when the number of attempts increase, there is a increase incidence of trauma to the airway, which is going to be deleterious in case of difficult airway management. So, just this is even though there is it has been almost 10 to 15 years after the introduction of Ambu Mask, still I feel it is one of the wonderful devices which is not been utilized properly. Here I am going to show you a video which shows that how it is called as a third generation, or how the self-energizing seal of Ambu Mask works. Here you see, when we press the Ambu bag, you can see there is upward displacement of this portion of the Ambu Mask. This is how whenever we delivered more pressure, it is going to be achieve a higher seal. So, the peculiarity of this Ambu Mask is when we give more pressure, when you are ventilating patient with 20 centimeters of water, it will achieve a seal. If we increase the pressure to 60 centimeters of water, it is going to achieve a higher seal, which is not going to happen with any of the supraglottic airway device. Now, moving on to the advancement. It has been since 40 years since introduction of first LM laryngeal mask prototype by Archie Brain. Still, we follow a blind insertion technique to reach a satisfying position. So, what the studies shows are 50 to 80% of blindly inserted first or second generation device are placed mostly suboptimally in the hypopharynx, and whatever available tests we have, like there are a lot of tests which are available for identification of the proper placement of a procele LMA, we all know. So, whatever available tests there, they are all inconclusive in confirmation of the proper placement of the supraglottic airway device.